Tonight, we examine a heated Senate exchange over health care, taxation, and economic priorities, featuring Senator Bernie Sanders and Treasury Secretary Scott Bessent. At the center of this debate are competing claims about Medicaid cuts, tax benefits for the wealthy, and the real-world impact on millions of Americans. As rhetoric intensifies on both sides, the key question becomes not just what is being said, but what the facts reveal beneath the political framing.
You all had a scheduled expiration of Obamacare subsidies, and you did not extend that when you were in charge. 5.1 million, 1.4 million illegal aliens on Medicaid. And there are work requirements. And our goal is to get more money to children and others.
Really? Your goal is to get more money to children, and working people. In Medicaid and the Affordable Care Act, the estimate from CBO, I believe, is that over 15 million people lose their health insurance. Yale University and the University of Pennsylvania estimated that when you throw that many low-income and working-class people off of health care, some 50,000 people a year will die. Tell me why you think it's a good idea to give tax breaks to billionaires and allow 50,000 low-income and working-class people to die unnecessarily?
Senator, first of all, that's overstated by 5.1.
Thanks, Mr. Chairman. Thanks, Mr. Bessent, for being here. Help me out here. My understanding is the Trump administration has, I think, 13 billionaires in office right now, leading government agencies. Is that about right, do you think?
I have no idea, Senator.
I think that's what the number is. Do you think it's a coincidence, given the large number of billionaires in the Trump administration, that this particular piece of legislation would provide $235 billion in tax breaks to the top 0.2% by expanding the exemptions in the estate tax?
Senator, I will tell you that when the 2017 Tax Cuts and Jobs Act passed, my tax rate went up.
Well, I don't know your exact situation, but I can tell you. Tell me about how many people do you think are in the top 0.2%?
Sorry?
Number of people in the top 0.2% who would benefit from this particular $235 billion tax break?
Well, I know the top 10% is now paying 7%.
That's not the question. My question is, why do you think at a time of unprecedented income and wealth inequality, when people like yourself economically have never ever had it so good, why do you think it's a good idea to cut Medicaid for low-income and working-class people by $700 billion to give $235 billion in tax breaks to the very, very, very richest people in this country?
At this point in the exchange, the debate shifts from raw numbers to underlying philosophies about economic policy. Senator Sanders frames the issue as a moral question, arguing that tax benefits for the wealthiest come at the expense of vulnerable populations. Meanwhile, Secretary Bessent challenges the assumptions behind those figures, suggesting that projections may be overstated or misattributed. This reflects a broader policy divide. Should economic growth be driven by tax incentives at the top or by expanding social safety nets? And importantly, how should data from institutions like the Congressional Budget Office be interpreted? Are these forecasts definitive outcomes or scenario-based estimates? What do you think carries more weight here, moral argument or economic modeling?
Perhaps a few hundred families. Please justify that and tell me about that.
Well, Senator, I don't know, but the Democrats had the trifecta, and there was no tax increase or wealth tax on billionaires. You choose.
I'm not talking about a tax.
You chose not to do that.
Mr. Bessent, I am not talking about a wealth tax. Explain. A few hundred of the wealthiest families in this country, $235 billion tax break. Explain to the American people why you think that's a great idea.
I think that this will increase small businesses substantially. That most small businesses, they are...
Has zero to do with, come on, you're smarter than that. This is the top 0.2%. This is not a mom and pop store. These are multi-billionaires, and the savings go to their kids after they pass away. This is nothing more than a gift to billionaires in this country.
Well, sir, that's just not correct, because
This exchange highlights the sharp divisions shaping today's economic and healthcare debates in Washington. On one side, concerns about inequality, healthcare access, and human cost. On the other, arguments focused on fiscal responsibility, economic incentives, and policy design. As with many political confrontations, the reality likely lies in how these policies are implemented, and how their impacts are measured over time. For viewers, the challenge is to separate rhetoric from evidence and form conclusions based on verified information. What's your take on this debate? Were the concerns justified, or were the claims overstated? Share your thoughts in the comments, and don't forget to like, share, and subscribe for more balanced, fact-based political analysis.